my cousin, if you Bethlehem, the pastor me yare, and I'm a bad. Oh, doctor, for now, show me. Show me. No pressure. The woman may do. Oh, my name is Sika, and you make preba. If you are free, I name is Sika. I do not create the vampire, my woman, so when I'm a cashier, when you see a woman.
My name is Dr. Yusuf Ade. I'm the President and the CEO of Partners for Compassionate Services USA. I'm obstetrician gynecologist at Sarasota Memorial Hospital. We came in here for the past week to present to the people of this community the needed services. Our aim was to provide good quality screening services to the people of the Bethlehem community in the Upper Denkyira West District of the Central Region of Ghana. This is a place which was identified as a needed community by the board in conjunction with our partners in Ghana here, known as the Green Baobab. Over the past 3 days, we have seen over 1,200 people with various diseases, including significant amount of hypertensive emergencies. We actually treated and transferred 2 people with diabetes ketoacidosis. I also provided obstetric care here to pregnant women, and today I have seen over 30 patients, each of which was provided with a complete set of prenatal care. I actually just have to transfer 1 patient to the nearest hospital, which is over 40 miles from here, for fetal heart distress. The people have been very supportive, and it has been a joy providing these services to them. One of the greatest challenges that we saw was that we did not adequately prepare ourselves for the level and the prevalence of hypertension in this area. I've known this area for a while, and I was expecting to see a lot of patients with malaria, diabetes, as well as asthma. However, over the several years, it appears these diseases have gone down, and we saw a significant amount of patients with hypertension. We treated people with hypertensive emergencies, and for a few of them, we actually have to refer them. I also saw a lot of patients, at least 10, with recent strokes. One thing I enjoyed most was that the people was very, very courteous, and they obeyed the rules that we set for them. Some of them waited for several hours to be seen, and apparently, according to their tradition, they allow us to see the older people before the younger people were seen. We actually had to see the chief of the town first, and followed by the Queen Mother before anyone else was seen. Additionally, they waited patiently, and they allow us to see anybody who came in with any medical emergency before they themselves. It appeared this is a community who is well knitted and prepared to sacrifice for each other. They were very, very grateful. Also, we put in a team of doctors, midwives, physician assistants, and nurses from various parts of the country who came together and worked with absolute professionalism to take care of these people. Only 2 of the nurses and midwives were from this area. They came as far as from northern Ghana and the Volta region of Ghana to participate in this activity. Most Ghanaians attend private events on weekends, but these healthcare providers decided to come here, this remote area. You don't know anybody here, but they came in here. Some of them slept here and worked with absolute professionalism to take care of these people.
Me free krom ha ya bra o me say doctor for be free Kumasi dunkwa na aga ha se no no nti ye nyina ye mra ne ye mehwe ye mpom din se bia wo yade bi kura na yade na hunta na unnim na obetie so bi wonyare kura nso awu nti bia na yade na ho nti opese wo hwe obia hodin na se yade bi wo ho te saa o ma me ye hu nuro ti me kura na ya hwe ma wie enso so nuro ade ama me no enye nnuke dabi ya anyi me kapre ba kura no.
My name is Denkyira and I work at KNUST Hospital, a PA in 10, and we joined this organization to embark on this health screening for the people of Bethlehem in the Diaso district. It has been a nice experience, working with people and then interacting with them, and it has been very successful. One or two things I want to draw our attention to is the fact that we had majority of them having this chronic illness and hypertension and not on medication. So I want to say or suggest that the Ministry of Health or those in charge of the health system in these communities, in these neighboring villages, should make it a priority to gear their attention and then some of their health resources towards educating and then providing medications for these individuals, because we had a couple of them with blood pressure so high and then even decay the blood sugar and all. So we are pleading, or we are suggesting or recommending that the government and the health workers or the staff who are in charge of these people will give more attention to them in that particular area.
That's what they're going to deal with, right? A lot of information on the medical history side. Yeah, it's taking too much time, so it's slowing down the system. So we are going to skip some of them. So some of them, that's how
I am Henry Hansen from the KNUST Kumasi.
The reason you are here.
I volunteered to be part of this noble venture because I think it's good for some of us who are living in endemic communities, who know about some diseases or infections, to come back to where we belong, to volunteer and to help our people in the villages, especially this place, together with the Green Baobab and the Compassionate Services. We see a lot of cases and we wish we could do more, but then the timing and the equipment to be used on the field is a problem. But then we also have to design how to come back later more efficiently to be able to take care of all these issues that came up, for instance, the logistics and some of the consumables.
From the Green Baobab and Partners for Compassionate Services USA, we have identified this area as a very neat area, and we are actually going to make it one of the places that we are going to use for piloting. This is the second time that we have provided services each year. Over 2 years ago, we presented the community with the supply of this healthcare center, and we came in this time to spend 3 days here seeing over 1,200 people. The community had approached us about an ongoing project to build a maternity home here. The nearest place from here where prenatal services or obstetric services can be provided is over 40 miles away. As stated earlier, I have just referred a patient who is full-term, actually 40 weeks and 2 days, to that hospital because of fetal heart tones which were low. And I'm only praying that she reaches there before any catastrophe. We have therefore decided that we are going to be supporting this community to build the maternity ward. I have also met with the elders and the town, the opinion leaders of this town, as well as the chiefs of this area, together with the assembly of the whole district. And I presented a plan, I shared the vision that this village has. So we are going to support them in any way. I will be going back to the US and trying to lobby hard so that I can get some resources to help them build this maternity home. This is a very